Hi, I'm Dr. Merkley. When people come and see me for cataract surgery, everyone wants to know what's the best type of implant I can put in my eye after the surgery. So I'm going to talk to you today about all the different options that I talk to people about for the different types of implants. There are options because there is no single perfect implant. We are bound by the laws of physics and the laws of the universe, and we don't have a lens that can focus everywhere all at the same time. We also don't yet have the technology to have a lens that can change where it's focused, kind of like your eye did when we were young. So what we do have are lots of different options that all have their different strengths and weaknesses. And my job as a refractive surgeon is to get to know you and your lifestyle and your goals and make a recommendation about which one of these types of implants is going to best meet your needs. So the first category of lenses that I talk to people about is a single focus lens. And single focus means that it's just going to be focused in one spot. We typically divide the world into three ranges: distance, intermediate, and near. Distance is pretty intuitive. That's going to be your driving vision or looking off into the mountains or the trees. Near vision is also very intuitive. That's going to be looking at a book or your cell phone. Intermediate maybe isn't quite as intuitive. It's going to be a little closer than you might think. That's going to be your dashboard in your car or the computer at your desk or sometimes things around your house. So those are kind of the three ranges of vision: distance, intermediate, and near. And that first category of lenses, the single focus lens, is just going to get you one of those ranges. If you choose that type of implant, it means you're going to need reading glasses or a bifocal to see at those other ranges clearly. The second category of lenses are astigmatism correcting lenses. Almost everybody in the world has some amount of astigmatism. If it's very low, it's not necessarily always in your best interest to correct it. Some people have small amounts of astigmatism and they don't put it in their glasses or contacts just because it's such a small amount. However, if you have higher amounts of astigmatism, it's going to make your vision blurry at every distance, and so you do want to correct it. You probably have some correction in your glasses or contacts, even if you don't know it. And what is astigmatism? You've probably heard it said that is if your eye is shaped a little more like a football than a basketball. So I have an eye model to illustrate that. So here's the front of your eye, and you're going to turn it a little bit to the side. What we're talking about is the cornea. That's this clear structure at the front part of the eye. It's kind of the windshield of the eye. If you do wear contacts, they rest right on the top of that cornea. So this is a perfectly spherical cornea. It has no astigmatism. If it does have some astigmatism, that's if it's warped a little bit like this. So that turns it a little more shaped like a football than the basketball. And that lens doesn't focus anywhere very clearly. And so like I said, you're probably correcting that with your glasses or contacts, and we can also do that surgically. The third category of lenses is a multifocal lens, and we're talking about getting focused in multiple of those ranges compared to the first category of just a single focus lens. So single focus gets you one of the categories: distance, intermediate, or near. An extended depth of focus lens or a multifocal lens can get you multiple of those ranges. So distance and intermediate and near can all be in focus for you. The fourth category of lenses is a light adjustable lens. It's kind of a unique one. Its strength is that you can adjust where the lens is focused after the time of surgery. So all three of the first categories, we put the implant in your eye and it stays that way forever. Lasts for many, many years. However, with the light adjustable lens, you kind of get to test drive your vision after the surgery. So we put an implant in at the time of surgery, you get to take it home, live your life, test drive it, and if you want to tweak and fine tune your vision afterwards to change your focus, what we do is we bring you back to the clinic and we shine a specialized UV light on the implant, and it changes where that implant is focused. So there you go. Those are our four options as of 2024. Maybe someday we'll have a single perfect lens, but right now we have these four lenses that all have their different strengths and weaknesses. So as I mentioned at the start of this video, my job as a refractive surgeon, when you come and see me, I'm going to do a thorough exam of your eye and find out if there's one of these lenses that's going to be better for your eye. And I'm going to try and get to know you as a person and your lifestyle, and what you might need for your occupation or recreation. And I'm going to make a recommendation as to which one of these type options is going to be the best one for you. Hope that helps, and have a great day.